How you doing, everybody? It's Mark, your host on My Labor Radio. Thanks for joining us. This episode, we're talking with Dr. Tim Peck. Now, you know the name from a number of things, most recently Project Next and the work he's doing to start a communications team to start talking about real issues for real Hoosiers. It's been a fantastic growth. I was one of the first folks that sponsored and jumped in on board with them too. Love what the work is that they're doing. We'll talk about that maybe later in the show, but I brought Tim on because he wrote an op-ed recently, and I want to talk, before we get to the op-ed, about this most recent campaign he did and how he's still in it to win it. Tim, thank you very much for joining me.
Thanks, Mark. I appreciate what you do every week with this. It's an incredible journey to watch. You're bringing voices to people who need them here in Indiana.
Yeah,
Yeah.
and that's why I love what Project Next is up to too, because it doesn't matter who's on. When you guys get there, I mean, I loved when a doctor and a priest walk into the bar. That to me was the best opening line I had to watch.
Yeah,
So
I love that one.
but that was great, and so but it just I got into it because I understand. Father, what was his name? Thank you.
Father Ted. Yeah,
That
Father Ted
Father
and
Ted.
Dr. Tim. Yeah.
And just, I mean, it was so cool to listen to it being, I'm not a Catholic. But I'm a
Uh,
Protestant kid growing up. But to listen to how you guys talked about the things you got into was wonderful. So thank you for the work you guys do too, because I say this all the time is that if it's not us, who, and if not now, when. It's
yeah.
very important, all the work we do.
Yeah.
In that last election, the 24 election cycle,
Mhm.
63% still voted GOP, and you came in with about 35 per 32.8%. So like
Mhm.
113,000 people in your district, which is a sizable district. We're talking about 18 counties here. So in
Yeah.
southeastern Indiana, so basically Bloomington, south of Indianapolis, all the way over to the Ohio and Kentucky lines in that respect there for people's perspective on it. What were your thoughts as you went door to door? You had to feel good about talking to constituents and getting a good feel for things throughout that campaign, didn't you?
Yeah, I mean, we did the work. We did the work, and I did the work. We were out there
Yeah, a
meeting
lot.
with, yeah, thousands, tens of thousands of people, going to all 18 county fairs, uh,
Wow.
sweating through the night every night. We did tons of work, including going to Republican debates during the primary, where because it's a primary, I'm allowed to go to those debates. And so I'd go to, say, the Bedford Farm Bureau, and there'd be
Beautiful.
13 Republicans on the stage debating various positions, and
Yep,
me, because my opponent didn't feel the need to show up, right? So
absolutely.
when I think about, we lost that race, I certainly didn't lose that race to Aaron Houchin. I lost that race to Donald Trump and to the top of the ticket and pulling down for straight party ticket. I think this
Right.
year is extremely different. This race has always been kind of a 4-year race for me, meaning get out there, put the foundation together, get the name recognition, and now charge toward a win in 2 years from now.
Right. Fantastic. And I can tell you, as an example here in Northeast Indiana, Kyle Miller, who's at the State House, did the same type of thing. He was at it for when, as soon as the election was over with, he was back out knocking doors again that following spring. So there was no let up. The needle never left the record, or for whatever term you want to use to describe that. So that staying engaged with voters is an important thing, because I think when you end up talking and giving your position on things, it's a practical thing that makes sense. And it's not a party line thing. It's a, hey, this is what I think we should be doing. And darn it, that makes sense, doesn't it, when people hear it?
That's right. And so we've already knocked about 2,000 doors
Right.
this spring and into the summer. We stopped during the really bad heat. Actually, people are back out this morning, which is great.
Oh, that's great.
And so getting that, we have a goal of 100,000 doors by the end of the campaign to knock on and tell people that we
Yeah.
care about them and just
Right.
show up, right? It's
Yeah.
about showing up. It's about being heard. And it's mostly about listening.
Okay.
And that goes for what we're doing on Project Next as well,
Yep.
which is about kind of freeing us from the fear and hate and division that we're experiencing right now, getting rid of the party politics. And there's nothing I think typifies that more than talking about what it is to be working, what it is to be someone who works.
Yeah, yeah, and that's the real deal, and that's why I've done the things I've done over the years. It's about working families, and they're everywhere. Whether they're in a nursing situation, a CNA, they're cleaning the hospitals, they're cleaning the clinics, they're working for folks, or they're in a factory situation, or they're farming. We're still all working families, and we all need those same things. I think what we're going to start seeing is a lot of deterioration with this big, beautiful bill that Aaron Houchin voted for. Obviously, you wouldn't have voted for that if you had been on the floor. But
Uh,
that's the failure of the top of the ticket is what took it, and I totally get that. That carried the entire state. It's the only reason Young and Banks are where they're at now too. So Young wasn't on the ticket, but Banks was. So been a really rough time for a lot of folks, but it's going to get rougher too. You're going to talk about that in a little bit, but I want to talk about this op-ed that you wrote.
mhm.
It was in the Bloomingtonian. Did I say that right?
It was
Bloomingtonia. Yeah,
the Bloomingtonian, and it was also in the News and Tribune, and there's a
okay.
letter to a smaller letter to the editor in the Louisville Courier, and a few other places. We just submitted it as well because it's getting traction.
Right. Great. Well, so I asked you to read it. So
Mhm.
let's give it a listen right now of Tim
Okay.
Peck reading his op-ed, and then we'll get back on the backside and start talking about it.
All right. By Tim Peck, emergency physician and candidate for Congress. Op-ed's titled Let Workers Walk. Indiana's physician non-compete ban is a step toward freedom for all. This month, Governor Mike Braun signed SEA 475 into law, ending non-compete agreements for physicians across Indiana starting in July of 2025. It's a move that puts patients first, gives doctors back their freedom, and challenges one of the most quietly damaging workplace policies in America. This legislation means hospitals and large health systems will no longer be able to prevent physicians from practicing medicine in their own communities just because they switch jobs. It's a big win, not only for doctors, but for the people they serve. I know this firsthand. A talented physician I know well who wanted to continue caring for patients in the area where she had lived, had put down roots, had to take a job 90 minutes away from home. Why? Because a non-compete clause in her previous contract, it didn't matter that her patients trusted her or that there were shortages in the very place she left. She wasn't allowed to work nearby. This is not unusual, it's typical, and it's wrong. Non-compete agreements were designed to protect trade secrets, but in healthcare and in many other fields, they become tools to trap workers, limit competition, and undermine public access to essential services. In rural communities like those across southern Indiana, these clauses don't just inconvenience doctors, they leave patients without care. So it's worth celebrating that Indiana took this step, and it's worth asking, why stop here? Nurses, mid-level providers, and other healthcare professionals still face the same restrictions. So do factory workers, HVAC techs, warehouse employees, and delivery drivers. In a so-called, quote, right to work state, where employers can fire workers for any reason, how can we justify contracts that tie those same workers' hands behind their backs? Let's be clear, right to work is a misnomer. It doesn't guarantee employment. It simply weakens unions and gives employers more power. Workers can be dismissed at will, but they can't always freely choose their next job. That's not freedom, it's control, and it's anti-competitive in every sense of the word. This isn't just a state issue, it's a national one. Last year, the FTC, Federal Trade Commission, approved a rule to ban non-compete clauses nationwide. But legal challenges, backed by the Trump administration, put that rule on hold. As of now, we're in a 120-day pause set to expire in July. What happens next could shape the future of workers' rights in this country. If I'm elected, I'll do anything and everything I can to make sure it's not just physicians who get this freedom, it's every worker in every industry. The FTC should move forward. The courts should uphold it. The Congress should codify this into law. Because the real question isn't whether employers have the right to look to lock workers into contracts. It's whether they should have to earn their loyalty by paying fairly, creating supportive workplaces, and investing in the well-being of their employees. Non-compete clauses are the opposite of a free market. They prevent workers from moving. They prevent employers from competing. They hold back innovation, wages, and stability for working families. Hoosiers deserve better. Workers deserve mobility, and our economy will be stronger when businesses compete for people, not when they punish them for leaving. Let's start with healthcare, but let's not stop there.
That was Tim Peck, Dr. Tim Peck, with your op-ed. Thank you for reading that, Tim. That has so many levels to it, and I totally agree with you that it's they're just bludgeoning the people with this tool. It's been very unfortunate to watch. So the actual law that was passed is Senate Enrolled Act 475. Now that was signed by Mike Braun, and so as of July 1, 2025. You cannot ask anyone to sign a non-compete clause in any collective situation because you're under contract with a hospital, correct? In your situation?
Right here in Indiana. So I'm in a special
Yeah.
situation, which is
Okay.
great, and a situation that I purposefully chose, which is I work for a physician group. I'm an emergency physician. I'm one of the rare people who work for physician groups still. And that physician group signs a contract with the hospital.
Yes,
And
versus an
so
individual, right? Yeah,
I don't have a non-compete. Why? Because it's physicians who are my bosses, physicians who are the people who are running this company that I'm working for, and they would never put me in a non-compete situation. That's
right,
just immoral. It
right,
just makes no sense to them. And
right,
so I live the example of what it is to be mobile, and because of that, I have loyalty to my employer.
right, right. And
They
it's
should
built
keep for
built
me
from
in the
within. Yeah, right.
yeah.
So why would you let's get into just a little bit and peel back why hospital administrators at this level want this compete clause, non-compete clause to try and control things. What do they gain from that? I don't understand. And the example you cited with your friend who had to travel 90 minutes to be able to be out of this window to be able to actually still work and still have that home. How frustrating that is. But what do they stand to gain by having this clause in there?
Yeah, so she had to leave because get outside of that window so she couldn't
Right.
go to the competitor across town, right? That's
Right.
there.
Yep.
And
Yep.
so they use it as a handcuff to say, you got to be locked up and you can't leave. What happens very often with physicians is that they are in medical school 4 years, working their butts off, and then they're
Hmm.
in residency 2, 3, 4, 5, 6, 7 years of work
Right.
just working. They are in debt.
Yes.
These physicians are in debt greatly. I myself had to leave with over $400,000 of debt at the end of that.
Yep.
Right. And so now you're in a position where you're very lucky, you're very fortunate to be serving your community, and you're very fortunate to have a good income as well. But you need that income to pay back that debt. And
Right.
so that first job that you get from residency into being what's called an attending,
Yep.
you are in no way trained to look at this contract. You are
Right.
in no way have any money to hire a lawyer to look at this contract. You're lucky if you have a lawyer friend, maybe you could send it to, kind of thing.
Yeah. Right.
And you're just happy to get work. And so
Right.
you sign this, you don't really know what you just signed.
Yeah.
Now you've established yourself, you've gotten your skills. Yes, you are thankful to your employer for doing that. And now you're in a position where you had put your family aside for 11 years and you
Yeah.
built a family, and now maybe you want to go live somewhere else, or you want to, you want to move somewhere else into a different job. There's, 1,000 reasons you might want to switch, and all of a sudden, you look at your contract, or you walk into HR and you tell them what you're doing, and they say, "Nope, you can't do that."
Right. And then they give you the black and white right here. You signed this agreement when you arrived. I did.
I
Yeah.
did 4 or 5 years ago when I was a kid. Yeah, I did what?
Right.
Yeah,
Exactly.
yeah,
Exactly. It sounds like the kid that was a songwriter in high school that goes and gets their first record deal and they get screwed out of everything they ever wrote. It's the same
exactly.
situation. Exactly right. Which I get. Thank you for explaining it that way because that helps people understand better what these healthcare providers are trying to do, which it doesn't seem to help health. It's not in there for a good health outcome. It is more to put a yoke on the employee to say, "Sorry, you're stuck here. We're stuck
Yeah.
here with you." And that's really all they wanted. They just wanted to make sure you were trapped in this situation. And financially, you are, because you can't just break away and say, "I'm just going to go to hospital B down the road or C over here." It's not that simple to do that and pick up roots and make the change and all those things. And I've heard so many people, whether it's a manufacturing job, well, people need to move to where the jobs are. I don't have the resources to do that. And it's the same situation you have in healthcare too. Are nurses in this situation, RNs, LPNs, whatever their
Yeah.
level is, physician's assistants, are they under this same type of yoke as well too?
Many and most of them. And what happens is that many nurses become contract employees
Yeah.
rather than full-time employees. And that comes with benefit without benefits, right?
Yep.
Or a
Right.
different way that you need to get them.
Right.
With an employer that's not completely dedicated to you, so you're not completely dedicated to them. They'll work multiple jobs at the same time. You see this in
Mm,
EMS, paramedics as well, that they're
sure.
contract employees for 3 or 4 different jobs, and then the employer can say, "We're not going to pay you, overtime if we're going to keep you capped," and it puts the power back into the employer a lot. That's one thing I would say, but much more important. Not to say that it's not important as a healthcare worker that you're
Sure.
handcuffed, but for the greater good, what has happened here is that by stopping mobility of especially nurses, of which we have a ridiculous shortage here in America,
Hmm.
and we're about to have an even bigger shortage with our immigrant crisis.
Right.
With what has happened is that without that mobility, patients are the ones that suffer.
Hmm.
They are the ones that will continue to have shortages, that there won't be shifts to where patients are going and um, where nurses are needed. One more
Yeah.
thing, with this big beautiful bill and Medicaid being cut, whether it's your Medicaid that's being cut or you have private insurance, your local hospital is going to get really hurt.
Hmm.
And so any hospital that's operating on a negative margin or thin margin right now, where in my district, that's 3 of them,
Hmm.
are likely going to either be closed or they're going to cut services. And
Yeah.
so when that happens, these people, they may be cut in various ways, and it'll be hard for them to find another job within the geographic area. So
Right.
that's still to be seen what's going to happen there. So there's a whole mess of things that are happening, and it's unfair that physicians are the only ones that are getting this good treatment. So good on Braun to make
Yep.
this happen. But
Right.
it's a little hypocritical to just do it for physicians, isn't it?
Yeah, very true. And that's a great way to say it too, because that's where I was going to go there next, and you took me there already. So thank you for pointing that out. Because
Yeah.
I mean, Mike Braun, I'm not been a fan of him when he was my U.S. senator either. But I can say that once I've read this and have a better understanding of where your position is on it, I totally get why this is important, and that was a good move. I don't know what's in it to gain for him. I'm sure the healthcare folks are just screaming at him right now for doing something like this because it kind of screws up their mojo. They're really driven by dollars. They're not driven by trying to have good, healthy outcomes for their patients. That's never been the case for any person at that level that's in the boardroom for whatever healthcare group it is. And here in Fort Wayne, where I'm at, we have a Lutheran health system, we have Parkview Health System, and now IU is building their huge hospital at the south side of Fort Wayne right now. So in the next few years, that'll come online. So they all want these healthy outcomes, but they also want to work. They exploit the employees that have to work for them too. So it's a
Yeah.
really interesting time to be building a hospital. I kind of thought, but here we are.
So
Go ahead.
yeah, just a comment about that is that I'm not a huge Braun fan myself, but we saw this coming even before he took office as governor, that
Yeah.
he has very friendly, some and many of the things he has are very friendly policies to health care for patients,
Mm,
and has less loyalty to the healthcare systems. So
okay.
he is putting a lot of these healthcare systems, including IU, in places to say you have to stop abusing our tax system, and laws have been passed around that. You have to stop abusing physicians not being able to move around and take their non-competes. There's a number of
Right.
these, and he's hired actually some kind of nonpartisan people to be leading up his health crew. So it's one place where I'm happy about what's going on, but at the same time, he's kind of burying
Mhm.
the lead where it's cutting Medicaid, right?
Right,
It
right,
doesn't make sense. It's like
right.
one hand is trying to help and one hand is trying to hurt, and I don't know
Exactly.
what we're
Yeah,
really doing here.
right, exactly. And the other foot will fall when that happens, but smartly, and I hate to say that, use the word smartly with GOP, but here we go. They actually put it so that it won't happen till after the 2026 election cycle that it'll really have an impact. So you'll see early January, February, March when the Medicaid, Medicare things start really having an impact on your state and your area. So prior to that, everybody's going to play the game of what? Nothing's wrong. Everything's fine here. Well, I don't know where the Democrats said that. They're crazy. They're losing their mind. Here it
Yeah.
comes. It's on its way. So a
I'd say that
game.
that's true, but people are already been cut from Medicaid enrollments and
Yes.
they're struggling to get back on. I see patients all the time who in the emergency department who come in who
Yeah.
think they have
Right.
coverage who do not.
Right.
Because they've been disenrolled for one paperwork reason or another. And this big
Yeah.
beautiful bill is about paperwork. People don't realize
Right.
that what it does is make the paperwork harder. That's really all it
You're
does.
swimming, right? You're swimming in it. You're already in a sick or a mental health situation that doesn't allow you to do that unless you have some advocate or someone with you that could do that and help you through that. You are screwed, and there's no way around it. That's just the way it is. Yeah.
No.
I wanted to talk a bit about within the op-ed. You talked about a number of things that I thought were good to point out to make sure folks understand it, and you put it in a really basic way so everybody gets it. And I totally grasped onto it as soon as I read it. But you also had a comment that as we text back and forth about a collective bargaining being used for patient advocacy groups to help create healthcare reform. You had me
Yeah.
at collective bargaining. So let's
Yeah.
have a discussion about that. I want to hear your thoughts on that. That was a very wide open place I wanted to go to.
Sure. Yeah, this is an aside from
Which
the
is the
we're
op-ed.
changing
Correct.
gears 1,000%. So anyone watching,
Right.
we're changing gears.
Yep.
Let's have a new mind and open mind to what I'm about to say. So because this is different, this is new idea. This is something that I'd really like to help with in Congress.
Yeah.
So collective bargaining is incredibly powerful to keep our rights as workers and make sure that the many are protected from the few who have power. Um, One of the things about our healthcare system now is that it has incredible waste and it costs a ton of money, right?
Yeah.
And
Yeah.
so I believe that everyone should have healthcare, but if we expanded the healthcare system we have now to everybody, we'd go even more into debt than we are.
Sure. Sure. In
What
its current state. Yeah. Right.
in its current state. So it needs to change. Even Medicare, public original Medicare benefit is administered. The people who actually do the work to pay the doctors and the
Yep.
hospitals and the pharmacies by Blue Cross Blue Shield.
Hmm.
Right.
Yeah.
So the administration isn't public dollars. It's going to private companies. So it's a misnomer in that sense to think that we have a purely public benefit because we do not. It's
Right.
controlled by
Right.
private companies as well. And it just creates bloat. It creates middlemen. And
Hmm.
so there are super utilizers of the healthcare system at no fault of their own.
Right.
There are the homeless
Yep.
who who are sick usually that helped get them in the position that they're already in, and now they're in
Hmm.
a position where they're exposed to the elements, etc., and they're even sicker, and are using our healthcare system in great deal. There are dialysis patients. Dialysis patients cost a lot of money to help keep people's kidneys and therefore their blood clean from poisoning themselves. That's what the kidney does. It stops you from poisoning yourself from yourself. So, and you having dialysis 3 times a week and just
Yeah.
constantly,
Right.
it costs the healthcare system a lot of money. There are patients who are end of life and
Yeah.
are utilizing ICUs sometimes to their disdain, and being poked and prodded in ways that they could have a better life otherwise. That costs, some estimates say 30-40% of our healthcare dollars are in those last 6 months of life.
Yeah.
So
Yeah.
there's and I can go on, right? There are people who are called dual eligibles, the who have Medicare and Medicaid. These are people who are aging, who are also disabled and under the poverty limit. These
Hmm.
people, that there's a lot of cost associated with caring for people like that. So think about that. Right now, we see that as a negative.
Hmm.
Probably listened to me and said, wow, that's a negative. They're costing the system so much.
Yeah.
But how much power does that give that group of people? How much power does it give that group of people that they cost the system most of the money that we're paying? They have
Hmm.
power in their hands because they control the dollars, right? And
Right.
so if they say, I demand a better system. I demand to be cared for. I demand to have services that allow me to get transportation to and from my doctor.
Hmm.
I demand an advocate who I can call, who can do the work, like you said, of
Yep.
re-enrolling me in Medicaid or can make sure that I can navigate my hospital system and all my doctors. I demand a better experience in healthcare in some way, right?
Right.
And if not, I'm going to keep spending your money, right? I'm going to
Hmm.
go keep utilizing everything that's going on. But if a patient advocacy group got together and said, we demand that, give us better resources, give us better places where these people can go, as where the people I represent can go as a group, where the resources are all there, then it'll
Right.
cost less. We won't just randomly use the system, but it'll be more organized. And if you can put in this structure of patient advocacy, it's essentially a collective bargaining agreement to
Right.
be able to get a better experience. So it's a little bit of an out there idea, but there's something behind it.
Well, it's that's what they understand. As long as we've been around, as long as you've been in healthcare, you've watched pockets of things happening as far as collectively getting together. Let's talk about nurses. There's huge push on that. Whoever thought Teamsters were going to represent nurses? Well, they
Right.
are, and they're working hard in the state of Michigan right now. Minnesota has a Minnesota Nurses Association. There's a American Nurses Association. They're everywhere. There's not a lot of that in Indiana, so we don't really have a lot of examples. But you look elsewhere across our borders, and there's a lot of that going on. And this is what the healthcare providers don't want: is they understand that solidarity, they understand that collective group together with one mindset. Something is getting in the way of their profits because it's all about a dollar and cent to them. That's where they're at, and they're not going to fight and change it to anything except what they got to gain. They have shareholders that expect some return on investment. They've already invested. Now they want their money back twice over. Let's do it again. At the behest of, unfortunately, Medicare, Medicaid, and those people working for them every day. So healthcare understands where you're at with that whole idea. They don't want something like that to happen. I got to think the lobbyists will want to knock that right off the shelf and not like it at all. But just in that thumbnail sketch you've just given right now, what a great concept. Thank you for, I mean, does this just kind of creep into your mind one day and you start realizing this is something we can do?
Yeah, it comes from so my background as an emergency physician, and then I kind of took a sidestep from traditional medicine and formed a telemedicine company
Right.
starting in 2011, really took off 2014, 15, well before telemedicine was a thing,
Yeah.
right? And we treated patients in nursing homes through telemedicine, giving
Oh.
24/7 care. Nursing
Hmm.
home patients usually have someone that visits them once a week if they're lucky, once
Sure.
a month sometimes. We
Yep.
were there all the time, and we were able to treat people before they had emergencies, just word of mouth,
Yes.
as
Which is the
well
whole
as
idea of healthcare, right?
right, right. Uh, as well as when they're having emergencies, be able to treat some of them there rather than go to the hospital. And going to
Mhm.
the hospital is a $20,000 an
Huge.
average
Absolutely. And
for this
staff
population.
has to get them into an ambulance. It's on and on. Yeah.
And the
Yeah.
patients, for the families, it's disruptive for
Right.
sure. But for the
Right.
patients, this particular population of patients, 53% of them have some level of dementia already. They all
Hmm.
become delirious by the time they get to the emergency department. They get put in the
Right.
hospital. They get sick. They are ignored, and it's terrible experience for them.
Yeah.
So we could treat them in a place where they were known and loved.
Yeah.
And we did that for hundreds of thousands of patients and saved Medicare $100 million in the process over a number of years, which
Hmm.
is what brought me to DC, where I
Right.
worked as a part of a bipartisan coalition to help get telemedicine implemented into the United States. So that included Medicare, Medicaid, VA. Medicare Advantage, et cetera. And
Right.
so
Right.
that's the work that I did. It was all bipartisan. I learned how to talk to people on both sides of the aisle. Uh,
Had to.
yeah, had to, right? And really, and I love telling this story because you go into a Republican's office and say, I have this amazing innovation. It's called telemedicine, right? They hadn't even heard of it yet.
Right.
Um, and it's going to save a ton of money, and it's also really good for patients. I'd be like, that sounds amazing. Let's do it. A Republican, and then you go to a Democrat, and you'd say, I have this amazing innovation. It's called telemedicine. It's going to help a lot of people, and it's also going to save a lot of money. And they would say, okay, yeah, let's do it. And so it's just changing the order of the priorities of
Correct.
their
We're
priorities, really
yeah.
their bosses' priorities and their voters' priorities. So yeah,
Right.
that's
Right.
just about how to talk to people.
Well, and that's a great way to look at it too, because having been in senators and congressional offices, state houses, I learned the same thing too. When you're talking about labor things, it's equal to exactly what you're talking about too. It's how you present yourself. You can't come in there and start swearing and knocking, kicking the can over, something like that. You get nowhere with that. You have to come in with a cognizant thinking to what your is. Let's give them the outcome of what we want and show them how we can get there together. They'll
Yeah.
believe in it, or they'll shoot it down just because it has the word union on it. But that was those fights can be fought though too, depending on your perspective. But so
So to
when
answer
you,
your question of like
yeah,
the progression of how I got here, the
sure,
next step was about something you were saying before about why the doctors were able to get this non-compete thing out of their lives, but the
yep,
nurses weren't. Because the way the healthcare system is set right now is that doctors are revenue producing and nurses are cost centers if you're
I
the
get it.
business owner.
Yep,
If you're revenue producing, you have a whole lot more power. You need me to make that money. If you're
right,
cost producing, right, even though the nurses are bringing more quality to the situation of a patient than anybody else in the system, including
right.
doctors. Uh, the cost producing, you have a lot less power. They're like, oh, maybe I could do it out with one or two of you, right? So that's the situation of
Right.
labor as we
Yeah.
know it. Yeah.
Right. Right. This is we've chased our tail like this for hundreds of years. We just keep doing it again too. And it's unique to you what you're working with. But when you started with that whole telemedicine too, it sounds like an easy sell. You really didn't have a lot of didn't have to jump through a lot of hoops to get people to get on board with you for that, did you?
Well, it took years. It took years to
Sure.
do it.
I get that. Right.
Um,
Because it was a brand
but
new thing. Yeah.
you had to educate people to what it was. Uh, the biggest problem was the CBO. If you're familiar with the Congressional Budget Office, they're the
Yes.
yeah, they're the people who score the bills and say
Right.
that this saves money, this costs money. They're the people who are saying the big beautiful bill is going to put us into 3 trillion plus more debt, right?
Hmm.
They're the people who do that, and it's a nonpartisan group. Uh, Usually, the new hires are from the partisan world, but it's a nonpartisan group in general. And the
Yeah.
CBO had no evidence to work off of.
Oh, yeah. That's a game changer for them because they don't, yeah, they have to have that baseline. Yeah.
Right. They have to have the baseline. And so what we did is we handed over all of our data blindly. We could not see it of what the
Oh,
cost savings were being, what the quality
right.
was.
Right.
I couldn't see it. And it was such a risk from a business standpoint, right?
Absolutely. Any attorney would tell you don't do that.
And we were told don't do that. And so what I did and handed over, and there were some researchers at Harvard Medical School that took it over a course of years, and public health administrator researchers as well, and then looked at it, and yeah, that's where the $100 million number comes from. And
Wow.
so um, that allowed us to get evidence to show that this thing really works.
Right, right. Well, thank you for taking that. It's a risk. It's not something you just oh, hey, we're gonna do this next Tuesday. You said it took
Yeah.
years to get this done. It was but you'd already been down that road with your residency. You just I mean the things you'd already done. So it was the right thing at the right place, the right time too. Good to have that going. Is that company still active and still functioning by and large?
No, so the 2019, the government shut down for the longest time in history. If you
Yes.
recall, the border wall was the main wedge there, but there was a whole bunch of other things that were really driving
Yeah.
it. That was the public wedge that was used.
Mm-hmm.
And it was a power play. And all these people who I was working with, both sides of the aisle, completely lost view of what they were working for, who they were
Sure.
working for. right?
Right.
They
Right.
let the government as the most fiscally irresponsible thing you could possibly do,
Mm-hmm.
and
Yep.
probably the most inhumane thing you can do for people to take away their services, right? So
Right.
at the same time, it's almost like the big beautiful bill, taking away services and being fiscally irresponsible at the same time. So that's what happened. And in 2019, nothing in health got done
Yes. Complete
because of
hold. Yeah.
complete hold. And so during that time, I closed the business down because we weren't going to get Medicare payments.
Mm-hmm.
And we said we'll spin it up another day when, telemedicine can come back and
Yeah.
we can finish the
Right.
work we were doing. Well, the pandemic happened just a couple months later, and everything that we needed to make telemedicine reality happened at the same time. And
Mm-hmm.
my focus became on telemedicine as a whole, more so than an individual business. Now it's an entire industry.
Yeah.
So we helped hundreds of millions of people, whereas this one business was helping a sliver of it. So that's
Yeah.
that's the evolution of it. And I mean, professionally, it's the thing I'm most proud of in my life for sure.
Absolutely. No, absolutely. You think about all the things and you'll look at this when you're in your 50s and 60s and 70s and say, I still like that. I still love what I did. That was a really important thing because the extra work you had to put into that to get people to believe in it, to understand it. But like you said, it's nonpartisan. It sells itself. Everybody jumped on board with it. And here we are today. It's a standard thing. I think about the corporations that aren't sending people on an airplane across the country to a meeting. They're having a meeting in the different buildings that they're in, getting things done that way. So everybody has gained from this whole idea, the Zoom, whatever it would be, whatever your Google meetings, whatever you have, whatever your system is, that has been a huge game changer for so many people and has just saved so much money. It just makes sense. And so thank you for being on the forefront of that. Although
Yeah.
you will have to be the one that reminds people about that. That's not there's no
Yeah.
plaque on the wall for you to get for that one.
But people in the industry know. So when I
Yeah,
meet new people, they'll say thank you to start a conversation, which is really
right
nice.
on.
The average person will. The talk about dedication. One of the things I had to do, I lived in a nursing home for 3 months.
Yeah, what a great
Yeah.
being just I just got through the whole thing with my mother and father. I'm at the age I've lost them both in the last 7 years, and so
Right.
I was in on a regular basis. So when I saw that you spent was it 3 months living in the nursing home, talk about
Yes.
that. Yeah,
Yeah, I did that as a way to understand everything I could about the nursing home industry. I understood everything about the emergency department. I'd been there, I'd worked there, I'd
oh
administrated
yeah,
there, been a chief there, a chief resident there, and so got that part down. But what I didn't know is why these patients were coming to me in the emergency department. And so,
right.
in order to expedite that and create a program, I didn't know exactly what needed to be created.
But
Right.
you got to
I
be there to find out.
got to be there to find out. And did things like I would do experiments where I would go to sleep, but then wake up at, midnight, 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock each night to walk the halls and see what it's like during that time. And
Hmm.
bank runs with the accountant and, spending time with the administrator and just sitting with patients and learning and families and getting on the back of an ambulance when they pick a patient up to see what happens when they get to bring them to the hospital. Just understanding the whole process so we can create a process to help these patients more.
Right, right. And whether it's a CNA or the actual RNs that are working in these nursing homes too, of just unbelievable work loads that they carry for such a small stipend, basically, of what they're paid for the work that they do. I was amazed when I got involved with some things at my parents' situation out of state, which included a lot of travel to do that. But I spent time talking to the nurse on the floor and asked them, she's standing outside and she's having a cigarette. And I was like, well, that's awesome. So I saw her. I took a walk down the stairs. We went outside and I sat and talked to her I got about 8 minutes to talk, but I didn't ask about her health or anything like that, but I asked about her income, her living situation, and her transportation and things like that. And she was taken aback at first, but she got into it and to tell me that she didn't have a pot to piss in, for lack of a better term, because
Right.
she was working hand to mouth and she was trapped here and didn't know how she was going to get out of it. It wasn't what she went to school to do. Have you
Right.
heard that term before too, along the way
Oh,
with
for
folks
sure,
you
for
talked
sure.
to? Yeah.
One of those experiments I was talking about when I woke up, but somewhere around 5 to 6 a.m.
Hmm.
I walked in. All of a sudden, there's just all these CNAs sleeping in the lobby.
Mm.
what is happening here? Why are these people just like lazy and off the job right now or whatever it is? And like
That's the appearance.
that's the
Yes.
appearance of what you think. But what you found out is some of them are sleeping in their cars outside. It's that they are coming off of their other job,
Right.
coming there, trying to grab a few hours of sleep before they start their new job at 7 a.m. in
Yeah.
that, right? And so they're working two, three jobs. And then this is also an immigrant population, that are working here, especially CNAs, home aides,
Yeah.
some 30, 40% in some areas are
Right.
people from other countries working. And so if you don't have a system that allows us to find talent in
Hmm.
other countries, bring them to the United States, especially with what's sometimes called the silver wave or silver tsunami, or people becoming, millions of people becoming baby boomers every month or becoming over 65 every month.
Right.
What are we going to do if the whole healthcare system can collapse if we can't figure this out?
Right. Right. It's built for that collapse, unfortunately, because that's the imminent thing that's going to happen in the next decade. Huge difference.
Right.
I'm in that group. I was born in 61. So I see where things are headed to, and it alarms me a lot. One of the sides to that too was I'm out of state, so I didn't have a laptop or anything, but I wanted to look at some emails. The phone dies. So I went to the public library. When I
Mhm.
walk into the public library, there's two CNAs who just left their shift with my parents on that floor. And here I am. They're using the computer too. Why? Because they can't afford one at their apartment or wherever their temporary
Wow.
living situation is. So you realize right away is, boy, there's a lot of systems that support everything that's going on, and they don't even have the support that they need to be able to do it. And
Yeah.
so when we closed everything out after my parents passed, I did have a chance to talk with the administrators and let them know how unhappy I was with their treatment of their workforce. That didn't go over well, but I'll leave it at that. Someone has to say that. Be the person that says that.
Mark,
I
from what
didn't
I
worry.
know about you, no, I don't think no one who listens to this podcast will be surprised by that story.
It worked. I definitely got their ire. My sister, who was she was power of attorney healthcare. She asked me when the whole thing was over with. She goes, "Did you have to say that?" I go, "What did I say that was wrong?" She goes, "Well, nothing, but I felt embarrassed." I go, "That's why I said it, because
Yeah.
they should be embarrassed too. That's what has to happen. We have to start spanking people or whatever your term is you want to use. We have to have these conversations." So,
And
well,
these people
Tim,
who are
go ahead.
making 16, 17, 15, $19 an hour to do this job
Right.
are not Democrats and they're not Republicans.
Yeah. They're
That
trapped.
that is not the first thing on their mind of
Last, yeah, politics doesn't
exactly
matter to them. Yeah, they
exactly.
do not. And
And
the frustrating thing is if you could get them to come together collectively, and that's a tough road to go to, knowing several in the healthcare industry, and I've talked about this endlessly because I've been around a lot of them, and I said, what's it going to take to get the nurse? Oh, I could never leave my patients. I would never join a union. I can't do. Okay, that's why the managers love you. Go back to work. I get it. So that's a fight too on its own level. That's another show altogether. How about that, Tim?
yeah, you know.
So we've talked about a number of things. I want to make sure if we have a few moments here that you want to talk about something that we haven't talked about so far.
The one thing that I always want to talk about is my son. I have a new 2-year-old son. We just did a little trip up to Niagara Falls, and he refused to
Awesome.
wear the poncho and got very wet. Um,
Totally love that. That's a real story.
and you heard his little voice before we started this
Who started
podcast.
here? Yeah.
Yeah, which is great to be home. But professionally, I'm running for Congress again. But that again is another misnomer. I've been running for Congress
Never
in
got off
order
that horse. Yeah.
to prepare for this moment that's happening next November, right?
Yeah.
Where people, as you said, maybe some of the big, beautiful bill things will be hidden on the other side of November, making
Hmm.
sure people realize what's about to come to them and
Yes.
what we can do about changing it. And one of the things that we can do and I can do today is have Project Next, which is a way of reaching people hyper locally. The whole idea
Right.
is to reach people in our local communities, lift people up in our local community. I don't care if they are Democrat, Republican, or whatever. I actually don't even care about their politics. I just want to highlight local stories about people doing good and show how government can enable them to continue that do that good. And that's what Project Next is about. So if you're looking for, heartfelt stories as well as some soul-crushing stories, and some real solutions right now, people are searching for solutions. We're talking about them constantly on Project Next. You can find us projectnextindiana.com.
Fantastic. Tim Peck, Dr. Tim Peck. So we would find you on the website. It's timpeckforcongress.com, FOR, not the number. And I'll have links in the show notes for that. Also Instagram, Facebook, where you can find them. Easy to follow. Once you get to the website, all the links are there as well, too. Tim Peck, thank you very much for joining me. This has been a great conversation.
Great. Yeah. Thank you for reaching out after the Bloomingtonian thing. It seems like that's gotten a little traction, and hopefully we can get that into even more people's hands to see that this administration, our state administration, is doing some things for workers. Now let's keep the ball rolling and do it for everybody. Let's not be so hypocritical.
Fantastic. Thanks for joining me, Tim. I really appreciate it.
Yep. No problem. Great to meet you.